Hi everyone, my name is Melanie and I am your IVF nurse. Today's topic is inspired by a few conversations that I've had recently with some people, various people across the Toronto, Ontario area that have been dealing with some of the clinics in Toronto. And they've been sharing with me their experiences when they go in for monitoring and how they're feeling when they're there, and I guess how it impacts what they will do in terms of their next steps. So bottom line is this, is that when you have your initial consultation with your reproductive endocrinologist or your fertility specialist, what you want to make sure is that when you go into that clinic, that you're not feeling that you're just a number. Clinics, yes, that are really busy. A lot of people speak highly of them. However, that may not be the type of clinic for you. You may want a clinic that is more patient-centered, where maybe nursing ratio to patient is a little bit more one-on-one as opposed to 1-on-10. And just how their whole process works. So what I would stress to patients is that, one, when you go into a clinic for your initial consultation, if something should make you feel that this is not the place for you, trust your gut instinct. There's something about it that is not sitting well with you. That's probably a good indication that your experience there may not be the best experience for you, or it may not be the clinic that is ideal for you in the experience that you're looking for in terms of creating your family. Now, what you want to consider is, and this can range from patient to patient across the board, some people don't mind. They want to be in and out, they don't care. Others want to be able to sit down, ask their questions, not feel like they're a number, not feel like they're herded animal going through a clinic or lining up and just being called, at the whim of the doctor. So as I mentioned, everybody is different in their expectation as to what is suitable for them. But the important thing is that if your clinic, upon your initial consultation, or if something should happen along the way during one of your visits and you think, you know what, this isn't for me, this is not the clinic for me, this is not the doctor for me, or maybe you've had a falling out with the nursing team, or there's just something that is happening that does not make you feel comfortable, then you are entitled to go and get a second opinion. Now, most doctors won't refer you themselves, so you'll have to go back to your family physician to get this. However, the other thing is that depending on the type of cycle that you're doing, if you are looking at possibly using an egg donor, if you're looking at possibly using the services of a surrogate, there are some great agencies out there that can guide you in the direction that would be best suited for you in terms of clinic and timelines, and they're great resources, experience that you want to have with your clinic. My services do involve support and probably bothering the nurses at other clinics as well, just to kind of stay on top and make sure that the patient doesn't feel that they are, just getting lost in the shuffle or doing whatever is being told without them having to ask questions. So there are some really good resources out there. If you are someone new looking at possibly deciding on which clinic to go with, if you're starting out, with timed intercourse, or you've already tried that and you think, you know what, maybe I need to look at doing inseminations, or maybe you've already done all of that and you're looking at a clinic to do your IVF procedure with, or even if you've done all of that and the doctor has told you your best chance of success is going to be with the use of an egg donor or a surrogate, depending on your medical history, then I would say reach out to some of those agencies that are available to you. They will be able to guide you in the right area. They can give you a list of clinics. In talking to you, they will be able to identify what your needs are specifically as a patient. Same thing. If you're contacting, I can help you decide which clinic may be best suited for you depending on your location, things I've heard or things I've even seen because I've worked in many of these clinics, which would be best suited for you, and get you set up so that you're having a journey towards creating your family in the best way with the best experience for you. Now, if you'd like some information on agencies, whether it be for egg donation or surrogacy or both, please feel free to contact me directly at yourivfnurse@gmail.com. Please feel free to check out my website, www.yourivfnurse.com. You want to be able to be putting yourself first. This is your family that you're looking at creating, and you do want to have the best experience. You don't want to be having an experience that's going to cause you more stress or more anxiety than you may already be experiencing just by having all of the daily monitoring that you need to go through, having an IVF procedure, frozen embryo transfers. So you want to look at having a resource that's going to be able to assist you, advocate for you. If you'd like information on agencies that are great resources, please feel free to reach out to me. Thank you for listening to me rant about this topic. And I would like to wish all of you, no matter what stage of the process you're in, that you do have a smooth journey and hopefully a successful outcome.